Chapter 19, Swallowing and Speech. Question 1. Food is prevented from entering the larynx during the pharyngeal phase of swallowing by a. Constriction of the laryngeal entrance, b. Upward movement of the epiglottis, c. Downward movement of the larynx, d. Increase in respiratory rate. Correct answer is a. Constriction of the laryngeal entrance. The laryngeal entrance is narrowed by action of the aryepiglottic muscles. The epiglottis moves downwards due to tongue thrust and elevation of the larynx. Respiration is temporarily suspended. Question 2. During swallowing the a. Auditory tube opens, b. cricopharyngeus muscle contracts, c. rhyma glottis opens, d. gag reflex is suspended. Correct answer is a. Auditory tube opens. Food and drink must be prevented from entering the lower respiratory tract during swallowing. Several mechanisms are recruited to prevent this, including closure of the rhyma glottis by adduction of the vocal folds and temporary suspension of respiration. The cricopharyngeus muscle is relaxed to permit passage of food from the laryngopharynx into the esophagus. The auditory tube is opened by action of the tensor and levator veli palatini muscles, elevating the soft palate to close off the nasopharynx. Question 3. A possible effect of damage to the third cranial nerve by trauma to the orbit is a. A convergent strabismus, b. ptosis, c. pupillary constriction, d. bitemporal hemianopia. Correct answer is b. ptosis. The oculomotor nerve supplies levator palpebrae superioris, so the upper eyelid may droop after injury to the nerve. Damage to the abducens nerve is likely to produce a convergent squint because lateral rectus is non-functional. Parasympathetic neurons in the third nerve innervate the pupillary constrictors. If they are not innervated, the pupil will be dilated. Tunnel vision is due to damage to the optic chiasma. Question 4. Which orbital wall is most likely to collapse in a blowout fracture? A. The roof, b. the floor, c. the lateral wall, d. the medial wall. Correct answer is b. the floor. The bones of the roof and lateral walls are robust, although the bone forming the medial wall is thinnest. It is buttressed by the bone separating the ethmoid layer cells. The comparatively thin bone of the floor of the orbit and roof of the maxillary sinus has no support and therefore is the wall that collapses.